Hi everyone, I'm Dr. Sophia Behrmann, audiologist at the Advanced Hearing Center. Welcome to our weekly information series. This week we're discussing ototoxicity. In the United States, there are over 100 classes of drugs that can damage the inner ear that are commonly used to treat pain and infections, as well as cancer, heart, and kidney disease. Oto means ear and toxic means poison. Ototoxicity is when certain drugs attack the inner ear sensory hair cells necessary for hearing and balance. Exposure to these drugs can lead to damage, often on a permanent basis, causing ringing in the ears, also known as tinnitus, followed by hearing loss or dizziness. Tinnitus is the most common side effect of the drugs and oftentimes the first sign. Some of the more common drugs that cause ototoxicity are certain chemo drugs like cisplatin, high dosages of non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen, pain relievers such as aspirin in high dosages, diuretics such as Lasix, pain medication drugs like Vicodin, and very strong antibiotics often used to treat UTIs and pneumonia such as streptomycin. There have actually been 2 drugs that can cause ototoxicity that have been making headlines recently, and I bet you didn't even know. Hydrochloroquine and remdesivir are known ototoxic drugs, so if you or anyone you know has been treated with these drugs in the fight against coronavirus, seeking help is important. Early intervention counts. If you're concerned about any of the drugs mentioned above, talking to your caring doctors can help educate you about the hearing health-related side effects of treatment-related medications. Getting expert testing, including baseline and regular screenings, will enable early detection of ototoxic impact, as well as timely response if and when hearing loss occurs. What are some of the symptoms of ototoxicity? Well, it usually affects both ears equally and starts at the higher frequencies, which are our clarity pitches, extending to the lower frequencies, which are our volume pitches. Some of the first signs of this kind of hearing loss is asking for repetition more often, saying huh or what, feeling like people are mumbling or confusing words with other words. Sometimes this hearing loss may be accompanied by vertigo or the sensation of dizziness where you are spinning or the room is spinning around you. These symptoms can show up days or weeks after treatment with these drugs has started, and it can continue to progress even after treatment has been discontinued. Prolonged exposure often leads to permanent damage, and this damage is directly influenced by the dosage of the drug that the patient takes. Often the elderly, who usually have fewer hair cells at the beginning of treatment due to their age, have more severe side effects. Our goals when monitoring patients who are at risk for developing ototoxic damage are to prevent and minimize the hearing loss, and also to help the patient maintain the most hearing possible. These are important quality of life issues. To do this, early detection of changes to hearing and audiological intervention when significant hearing impairment has occurred is key. When changes are detected early, the physician can be alerted so that an alternative treatment protocol or plan, possibly with less ototoxic medications, can be considered. To make a monitoring protocol really effective, it's extremely important to obtain a baseline evaluation before starting the treatment with the ototoxic drugs. When a permanent hearing loss is detected through a monitoring program, a licensed audiologist can provide various resources like counseling, communication strategies, and prescribing amplification or assistive listening devices. An ounce of prevention is worth a pound of cure, so if you know anyone undergoing treatment with these drugs, we'd really appreciate you encouraging them to see us for a thorough evaluation. Healthy habits matter, and with your caring guidance, we can help them to hear beautifully. May I ask, is there anyone you know who we can help take great care of? Thank you.